All right, today we're going to dive into a pretty wild medical mystery, one that's locked deep inside our own heads. We're going to see how a single point of damage to our body's wiring can set off this bizarre and super specific trio of symptoms, all because it affects two crucial cranial nerves. Let's get right into it.
So what is the hidden connection here? I mean, what could possibly link your voice, the taste on the back of your tongue, and, yeah, your gag reflex? They seem totally unrelated, don't they? But the answer is actually buried in these complex information highways running through our brain, the cranial nerves.
To solve this little puzzle, we've got to meet the two key players involved. So let's start with the first piece of the puzzle, cranial nerve number 9.
Okay, so this is the glossopharyngeal nerve. It's a mouthful, I know, so we'll just call it CNIX. Its main job is basically to be a messenger, carrying some very specific feelings and sensations from your tongue and throat right up to your brain to be processed. Think of it like a dedicated phone line for a couple of really important reports.
And what's wild is how incredibly specific its jobs are. First, CNIX is in charge of taste, but get this, only from the back third of your tongue. And second, it's the nerve that triggers the gag reflex. You know, when you think about it, both of these are critical protective functions, right? They're like a final line of defense, warning your brain about what's trying to get into your body.
All right, so that's our first nerve. Now let's move on to the second character in our story. It's a neighboring nerve, but it has a completely different and equally vital job. This is cranial nerve 10.
And this one is the vagus nerve, or CNX. Now, this nerve does a ton of things, but for our story today, we're really just focusing on one of its main gigs. It's the master controller for the muscles inside your larynx, what we all know as the voice box.
So here's the crucial point. By managing those tiny laryngeal muscles, the vagus nerve is what controls your voice. It lets you speak, it lets you sing, it lets you shout. So it follows, right? If there's a problem with this nerve, if that signal gets weak or gets disrupted, the immediate result is often a hoarse, strained voice.
Let's just pause here for a second and see how this is all building. On one side, you've got nerve 9, handling taste from the back of the tongue and that gag reflex. On the other side, you have nerve 10, taking care of voice control. Two completely separate nerves with two very distinct sets of jobs. So what in the world happens if both of them get damaged at the exact same time?
And that brings us to the core of this whole thing, what's called a combined lesion. This is where it gets really serious. Because a single point of damage, say from a specific kind of tumor or an injury right at the base of the skull where these nerves run super close together, it can affect both of these information highways at once, and that causes a very unique cluster of symptoms.
Just imagine a single frayed wire in a bundle that shorts out two completely different circuits. That's pretty much what a lesion does here. First, the damage happens, hitting both nerves right where they're neighbors. Immediately, nerve 9 just stops working, so the signals for that posterior taste and the gag reflex are gone. At the exact same time, nerve 10 fails, and the signal to the voice box muscles gets cut. And the result? You get this trio of symptoms that appears all at once.
And this brings us right back to our original mystery. But now it all makes sense. That seemingly random set of symptoms isn't random at all. It's actually a super precise diagnostic clue, pointing a big, flashing arrow directly at a single problem affecting both nerves 9 and 10.
So let's just connect the dots. A loss of taste from the back of your tongue, that's a failure in nerve 9. A missing gag reflex, also nerve 9. And a hoarse voice, well, that points directly to a problem with nerve 10. So when a doctor sees all three of these symptoms show up together, it becomes this powerful clue that tells them exactly where to look for the underlying damage.
So there you have it, one single problem creating three distinct clues. It's just a perfect reminder of how incredibly complex and intricate our nervous system is, where damage to one tiny spot can create this cascade of unexpected effects. It really makes you wonder, right? What other hidden connections are just waiting to be discovered inside our own bodies? Thanks for watching.